To the Point with your host, News Channel 5's Kelly Dunn.
It's the latest battle in the drug war. Federal, state, and local law enforcement agencies teaming up to shut down pain clinics and arresting doctors allegedly selling thousands of prescription painkillers illegally. Good morning and welcome. We're talking about pill mills and other crime and law enforcement issues today, and my guests are some crime fighters. Palm Beach County State Attorney Michael McAuliffe and Sheriff Rick Bradshaw. You could say it's our own law and order version of To the Point. We thank you very much for being with us today.
My pleasure.
Okay, pill mills. How extreme of a problem do we have here, Sheriff?
Well, we had a problem that was very extreme to start with, but the good thing about it is we're making some headway on this. The partnership that we've developed here, not only with the state attorney, but also with our federal partners, we're putting a dent into them. We've taken some serious pill mills out of the system. There's a lot more to come, but we're making a dent in them.
Right. I mean, the numbers show that there were more licensed pain clinics in Florida than there were McDonald's and Burger Kings. I mean, obviously it didn't happen overnight, or did it? How quickly has this been growing?
Well, it's mushrooming, but it's relatively recent vintage. It's the last 3 years that it catches on like wildfire and spreads quickly. And that's why the law enforcement response needs to be equally quick and aggressive. Why
is it growing and mushrooming so much, especially in the last 3 years?
Well, I think some of it is the demographics of South Florida. There's a lot of travel in and out. There's a lack of regulation on the pain clinic side of the equation. And I think that someone hit upon the opportunity to have addicts as a steady source of income and a demand for these, what are otherwise legitimate medication. But when abused and when fed based on a cash, not medical need, it becomes an end in of itself.
And we were just saying before we started, I mean, total cash business, and we mean big bucks for these doctors.
Absolutely. You know, you don't get to pay by cash. You can't do a check, and it's not insurance. It's all cash. They're not reporting it, and they're making millions of dollars. And we took $2 million out of this last operation in cash.
Wow.
It's crazy.
Where are all of the clients, the customers coming from? Are they local?
They're local and they're out of state. I mean, you will see cars from Tennessee, from Kentucky, from Georgia. They travel down here just for a series of visits, all paid in cash. They fill the prescriptions and they head back to their home states to either consume, but more frequently to peddle the pills on their own turf.
And this Palm Beach County is one of the worst spots. I mean, along with Broward, I understand you were saying, right, Mr. McAuliffe, in addition to Hillsborough County is also
County,
a big problem?
Orange County, but Broward and Palm Beach County is the epicenter of the problem.
A federal study in 2009 said Florida distributed more than twice as many oxycodone pills than any other state in the country. I mean, did we see this happening, or did it all of a sudden kind of sneak up and it was this gigantic problem?
Well, see, that's why the problem got like it was, because we weren't paying attention. And now it's easy for other people to come here because we don't have any way to track it. And I know we'll talk about that a little bit later on, but the database is very important. We're one of a very few states that don't have a database to track prescription medication.
Because otherwise there's no way to know who's coming in and out of the doors, right?
That's exactly right. That's how you can doctor shop so easy.
Right. I mean, there's the doctor shopping on the retail end of it,
right,
and then there's the supply chain through the physicians and the pain clinics. And so you have to attack the problem from all angles.
Prescription drug abuse in Florida is blamed for 7 deaths a day. First of all, obviously these doctors could care less that this is killing people. I mean, they're just in it for the money. But is this equivalent to the cocaine and the crack cocaine problems on the streets we had back in the 80s?
Well, in some ways it is. But in Palm Beach County, every 27 hours, we handle an overdose death. And it's prescription medication. It's not what you're talking about. You know, the average person thinks of an overdose death of somebody that's got a needle in their arm laying in a dusty corner. No, these are people between 18 and 25 and 30 that are taking sometimes just 2 pills. They take 2 different prescription medications, maybe have some alcohol with it, but the interaction between those chemicals restricts their breathing. They fall down. If they're lucky, they fall in a place where they can breathe. More times than not, they don't, and they're dead. And that's what this is.
What's the most difficult part for the Sheriff's Department in investigating these cases?
Well, the people that are there at the scene, lots of times they try to help the people. Sometimes they'll put them in a bathtub, put water on them. They don't call right away because, see, they're worried the fact that, you know, they know they've got the prescriptions, medication, and they shouldn't have them. They're hoping the person's going to regain their breath. So there's some downtime and lag time between the time that the actual death occurs, where it occurs, where they end up at. So, I mean, there's some logistical problems there. More times than not, we can figure it out, but they don't call right away, and we're trying to figure out a way to tell them, you know what, call right away. Maybe we can save somebody.
And then prosecuting them, has it been difficult once you do? You know, I mean, we had raids just within the last couple of weeks. So is it difficult to then prosecute these cases?
It's important to prosecute them well so they stick, so that the statement is made in the community, both locally and statewide and maybe nationally, that this is unacceptable in Palm Beach County. We have almost 400 trafficking in oxycodone cases pending in the state attorney's office now. We have 9 physicians currently under criminal charges for trafficking, several for RICO violations, allegedly running a racketeering organization, and we have almost 40 doctor shopping cases. So we have a large inventory, and I will tell you, unfortunately, business is high.
I'm interested in these doctors that are then arrested. Do you find that they were normal practitioners before, and maybe the lure of money kind of drove them in there, or are they coming from out of state as well and setting up shop here because they know, hey, this is the great place to, you know, get cash for pills? What are you finding about these?
I don't think that there's any one profile that will tell you or be predictive of whether a physician's going to cross the line and cease being a practitioner and really be a drug trafficker. You know, it's really based on their particular behavior in those particular cases.
And the sentences for these people once they are caught? I mean, trafficking, I mean, how much are they looking at for time?
Tough. We have mandatory minimums that go anywhere from 3 years to 15 to 25 years. Just in the past 2 weeks, had a physician plead guilty to trafficking and was sentenced to 10 years in the Department of Corrections. So we're serious in terms of our crime-fighting initiative. This enforcement front is here to stay, and we're committed to eradicate pill mills.
Yeah, and I think that's a good message for the people that are watching to get out. You know, if this thought crosses your mind, you need to think twice. Because the message here is we're not stopping with just this first group of raids. We're coming after a lot more people involved in this because there's a lot more out there to do. But because the state attorney's aggressive and he has state attorneys assigned to this investigative process, we don't make the mistakes that we used to make where we just did the case and then came and filed it. Now these are court ready, they're ready to go. Prosecutions are going to be good, and we're going to be aggressive with it.
Who are the customers? I mean, who are the people that are out there doctor shopping? And I mean, the addicts, I know, but who are they?
It's both. It's people that have issues and they're addicted to it, and they just got to have volume. And then there's the people that can get it real easy and go out here and sell it and make a lot of money. So you got both of them. If you see the surveillance videos of some of these places, the room's full of them. They're out the door around the corner. Walgreens doesn't do that much business.
Exactly. And it hurts surrounding businesses. What is the impact on the communities? And a lot of them are in these strip shopping centers that some of the ones I know that you all raided. What is the impact on the others?
It's severe. The businesses that were surrounded by the pill mills that was up there, when we came to arrest those people, the business owners were out there, they were literally clapping, saying, you know what, this is killing our business. These people are in here day in and day out. It's causing problems that we can't do our business normally like we want to. And of course, in residential areas where you have the vehicular traffic and the foot traffic, it's not good. The quality of life is brought down.
Is there anything John Q. Public can do to help you?
Well, yeah. Just like we always ask them to do. If you see something that's not right, call us. Doesn't matter how insignificant you might think it is, we want to hear about it.
Right. Yeah, exactly. So speak up.
Absolutely.
Because it can be the difference in bringing, you know, one of these to an end. Yeah. All right, there is a fight over the best way to take on the prescription drugs, as the sheriff alluded to a few moments ago. Coming up next, we'll take a look at how it's turned political. Welcome back. We're talking about pill mills and the illegal selling of prescription painkillers. And one of the issues developing is the way to fight them and the use of a database. Ideally, the database would be used to monitor the sale of prescription drugs and cut down on doctor shopping. Governor Rick Scott wants to shut down the database plan, saying it is ineffective and expensive. First of all, Sheriff, explain, how does this database help you all? How does it work?
Well, right now, you know, it took 7 years to get this bill passed. And the legislature knew how important that was. And the reason is you have all this information that's out there now. I mean, every time there's a transaction, the information's there. There's just no central repository for it to be able to look at it and say, okay, today this person got this much. Now they're back within 24 hours and they want the same thing in the same volume. That's too quick. They went to another doctor. Because there's no way to correlate this information right now. It's easy for people to doctor shop.
Are the bad doctors, though, going to be keeping, I mean, would the pill mills be submitting that information to the database? Or?
Well, if you require them to, the legitimate ones will. And that's what separates the legitimate pain management practices from the illegitimate pill mills. I mean, the database is the #1 tool that's missing in our toolbox right now for both legitimate physicians and for law enforcement. It needs to be comprehensive. Quite frankly, I personally believe it needs to be real-time. Right now it has a lag of approximately up to 15 days, and I think physicians should have to check the database before they write the script. So not only am I supportive of the database, I don't think we've gone far enough in terms of making it the most effective tool that we can.
Is it expensive, and in a time right now when you're looking at such a huge budget shortfall?
It is the best investment we can make right now regarding this issue for the public's health.
I mean, when you stop to think about it, all right, they say it's maybe 500 million?
$500,000 to run it on an ongoing basis.
But if you take all the sheriff's offices, all the police departments, and some private industry in this, and everybody contributed, you could come up with this every year to support this very easily through forfeiture funds. And we've kind of floated that idea to start with. But, I mean, realistically thinking, in today's world of advanced technology, to have this on a real-time system is really no big stretch. It can be done very easily. And the fact that it costs that much to finance it, I don't think that's a big issue in a state this size with as many law enforcement agencies as this would help.
The governor also said it was ineffective. Has it been effective?
Well, we certainly want to find out in Florida whether a database is effective. I know that the argument has been advanced that in other states that have databases, it hasn't reduced overdose deaths, but I haven't seen the underlying data. I will tell you one thing. It's not just coincidence that Florida is ground zero for pill mills, and we are the largest state without a database.
You know, I think one of the alternatives they've thrown around is simply limiting the amount of drugs that doctors can dispense. Is that not an option? You're shaking your head?
Well, one, they're not mutually exclusive, so it can't be used as the fall issue to get rid of the database or deauthorize it. If dispensing restrictions make sense, I'm open to learn about what those restrictions might be and how they might be successful on the supply part of the chain. But, you know, there are a lot of legitimate physicians that need to have on-site dispensing capabilities, either as pharmacies or as dispensing physicians. So don't limit everybody because of the small abuser group.
Well, and you bring up a good point, and you've said it twice now, about the legitimate ones. And there are legitimate pain clinics out there. There are people with pain who need to go to a pain clinic, right?
And there's a lot of them. There's a lot of good people out there that are really doing a lot of good. But those are legitimate pain clinics. When you go in, they're going to examine you. They're going to do MRIs. You have the ability to write a check or use your insurance, okay? And those, we don't have an issue with those. But, you know, bells and whistles go off when you walk in and you say, I got a little bit of a pain and I need 180 Oxycontin. And he says, not a problem. I'm not even going to examine you. And here it is. Go right down, you know, around the corner and get them. And it's only cash. Two different things here.
What's it going to take to stop this problem here?
Well, over a year ago, the sheriff and I were the primary hosts of a community summit here in Palm Beach County. And we weren't certainly the first to talk about it publicly, but we early on recognized that we were in a position to try to make a difference. We have created the Diversion Task Force here in Palm Beach County, which is a partnership between our offices and several municipal police departments. And so we're focusing our attention, our resources, and our commitment to eradicate the problem. And so it's a long-term relationship between all the law enforcement authorities, and we need the support of the community.
anytime you have a system like this, I equate this to the gangs. It's taken us almost 3.5 years to really make a significant dent in the gang situation, which we have, right? It's going to take us that much time or more to make a significant dent in this problem too. But there has to be a starting point. We're at the starting point, and we're sinking our teeth into it, and I'm going to tell you right now, we're going to go after it hard, and the partnership that we've developed, with the State Attorney's Office and our other law enforcement partners, we're ready to go.
All right, well, coming up in just a moment, we're going to take a look at some other law and order problems. One of the issues that doesn't get too much attention is the court system and how much of a strain it is under. State Attorney McAuliffe, the budget crisis in this are prosecuted.
We're in the middle of the worst fiscal crisis in Florida's modern history, and we're not exempt from the negative effects of trimming the budget. Some of it is good in that sense we can get more efficient, more performance-oriented. All those things about private sector performance principles, they apply. But we also need the tools in the public sector, and you can't do crime fighting on the cheap.
Well, and you're funded, the legislature funds you all, and you're down, you're down, what, 15%?
15% over the last 3 years.
So what does that mean to the average person watching? What are you not able to do or what have you had to try to do differently now?
We're as lean and as mean as we can be. Further cuts by the legislature this session will start getting into bone. And that will put at risk some of the great enforcement programs that we have with the sheriff and in the community, the predator unit, the gang unit, the public integrity unit. All those specialty units require experienced prosecutors, and retaining those prosecutors is my #1 priority as the state attorney.
Is there a backlog in the court system because of lack of funds? Is there any kind of a holdup there too?
Well, the criminal side of the equation in the court system tends to be the last to be actually cut. The civil side gets the cuts first, and I know if you talk to Chief Judge Blanc, those cases are getting delayed. But we are at that tipping point. This is the year where we are on the tipping point in terms of cutting into core services.
Now, any type of a problem with prosecuting and in the courts, how does that affect you when it comes to jails?
Well, the jail's expensive to run anyhow,
right,
regardless of what is going on in economic times. And, the jail is driven by the number of people that you're going to have in custody. And everybody that gets arrested in Palm Beach County, doesn't matter if it's in the city of Lake Worth or Palm Beach or West Palm Beach, comes to the county jail. All right? So I've got to get everybody's prisoners. My average daily population goes between 2,850 to 3,000. At $130 a day, and that's not including the personnel costs, it gets very expensive. It costs about $140 million a year to run the jail.
Is there, have you had to make drastic cuts in that regard because of?
Well, fortunately, you got to understand that the county commissioners, they've got a very tough position. They've only got a certain amount of money to work with, and they've been very good at understanding that, what comes first is public safety. That's the sheriff and the fire department, and the services to the public. When services get cut, we don't make a product.
Right.
Staff goes down, services go down. Right? One thing that I will never do is cut deputies off the road. We've done a lot of things to get ourselves physically where we need to be, and we've worked very good with the county commission. We'll work with them again this year. But there's only so far down we can go.
Well, exactly, and I think the people that you are protecting are demanding, hey, figure out something, but don't take the law officers off the street that are going to allow the bad guys to get me. So
that's it. The volume of calls go up. We're going to do over 1 million calls for service this year.
Wow.
In 2006, I had 2.3 deputies for every 1,000 calls for service. Now it's down to about 1.3, which means it takes me longer to get there. And there's more gun calls. The gun calls have steadily gone up, so it means you got to deploy more deputies to those calls, which doesn't make them available for other calls. So, you can get really backlogged here if you don't watch out.
Our caseloads have gone up steadily over the past several years in terms of prosecutors. And what you don't want is a prosecutor resolving a case, pleading it out, because they don't have the time to prepare it instead of on the merits of the case. That would be a horrible result and consequence, unacceptable, actually,
right,
to me and to the community.
Oh, absolutely. I can certainly understand that. I know you're doing everything you can to prevent that from happening, and you to prevent from taking your guys and women off the street as well.
Well, we don't want to get behind on the gangs.
Right.
We've got the
exactly.
pressure on them where we're at now, and all this is manpower driven. So,
Exactly.
the money that goes to the budgets, both for the state attorney and the sheriff's office, is money that's spent to protect the public.
We'll be back with more right after this.
Your News Channel 5 updates throughout the day on News Radio 1290 WJNO.
And we say thank you to State Attorney Michael McAuliffe and Sheriff Rick Bradshaw. We appreciate your time. Good luck. Keep us safe. Keep prosecuting the bad guys.
Not a problem.
Thanks, Kelly.
Thank you for spending time with us on To The Point. Have a nice Sunday. We'll see you next week.